Optimal trial is the first randomized trial that was designed to look at what was appropriate question at that time, a thalidomide-based combination versus a bortezomib-based combination with bendamustine and dexamethasone in the newly diagnosed myeloma patients presenting with kidney failure. There are close to 30% of patients who have poor kidney function, but about 5 to 10% of patients who may be peri-dialysis or require dialysis in this patient population. So we looked at patients who had GFR of less than 30 mils per minute. And in this study, although it was quite challenging to recruit, partly because bortezomib became available for patients with renal failure when we were running this study. And also what we found that when patients were presenting with renal failure, their ECOG performance status was significantly poorer, and we were unable to recruit these patients. We also found, because of the way renal failure is managed in the UK, where there are the centers which do dialysis and centers that don't do dialysis, we did not have the patients in the right centers for us to be able to recruit. But despite all the challenges, we did find some important results. And the important results are bortezomib-based combination does induce significantly deeper responses for patients. So earlier responses and deeper responses were certainly seen with bortezomib therapy in comparison with thalidomide therapy. With the deeper hematological responses, we're seeing more renal responses in the bortezomib therapy arm in comparison to the thalidomide arm. But there are several open questions that are still to be answered. And we're happy that most folks are using bortezomib-based therapy for newly diagnosed myeloma patients with renal failure. The key questions that now that are left are, can you use good combinations? Do you have to use continuous therapy for these patients to make sure that their renal function does not get any more worse? All of those are kind of open questions. So we look forward to try and develop a European level collaborative trial for newly diagnosed patients with myeloma and renal failure in the future with all these results.